about what we cut and what we didn't. We made a couple of mistakes.
No, I don't
That
think
was
you
one.
were trying to be as careful as you can. I mean, that's the problem that we've seen by rushing these decisions. This was, I know, early in your time there.
Senator, I understand. I understand that if you look at this from a distance, you'd say, why don't you just do this surgically and cut one person at a time? This agency has grown so big, so fast, and everybody.
Tension inside the hearing room shifted the moment Senator Andy Kim began to speak. This was not a routine policy dispute or a partisan back and forth. It was personal, emotional, and deeply tied to one of the most painful chapters in American history. Before we go any further, make sure you subscribe to the channel. These hearings matter, and subscribing helps you understand what government decisions really mean for the people affected by them.
Thank you, Chairman, Secretary. I wanted to just relay, I had a town hall. I had a fire captain show up to this town hall, somebody who worked at Ground Zero, and he is somebody who said he was diagnosed with cancer. He said he's on borrowed time. And he was livid, absolutely livid about what he said, the administration gutting the World Trade Center health program. And we've talked through some of these cuts that have happened before, some staff cuts, some maybe brought back on, the administrator cut. I just need to hear from you. I promised this fire captain I'd ask you about this. What in the world happened? Why was the staff cut for this program? What are we to expect going forward?
I restored the staff to that program.
But why was it cut to start with?
It was, it was part of the overall budget cuts. Our agency was asked to make very, very serious budget cuts that were going to be painful, and some of them should not have been made, and that was one that should not have, and I reversed it.
Were you unaware, or were you aware that the decision to cut NIOSH staff would cut that World Trade Center health program?
Well, my agency is the biggest agency in government. It's twice the size of the Pentagon. It represents about 20% of the U.S. economy. We have hundreds of institutes and sub-agencies. We try to be as careful as we can about what we cut and what we didn't. We made a couple of mistakes.
No, I don't think you were trying to be as careful as you can. I mean, that's the problem that we've seen by rushing these decisions. This was, I know, early in your time there.
Senator, I understand. I understand that if you look at this from a distance, you'd say, why don't you just do this surgically and cut one person at a time? This agency has grown so big, so fast, and everybody who comes in says, I'm going to cut it down, and nobody's been able to do it. And there was an understanding that the longer that you wait, the more the inertia kicks in. And we had to act quickly so that we can do something for the American people that is lasting. And we understood that there would be some mistakes made and that we would go back and reverse them when they were made. But it was more important to do decisive action quickly that could eliminate the metastasizing of this agency to, which was growing and growing as our health declined.
So where is this going to land now? Can you tell us right now that the staffing of the World Trade Center health program will go back to where it was before you became secretary?
That program will continue. There will be continuity in that program. That's
continue, yes, but at full strength of where it was before you were secretary?
The program itself will continue.
Well, look, the fire captain also raised this issue about the National Firefighter Cancer Registry, also something I promised him I'd ask you about. Why was that shut down?
Cancer, I don't know about that.
You don't know about this?
No.
Okay, well, look, what I'll just tell you is...
I'm happy to work with you on it, though.
There's a National Firefighter Cancer Registry, and this is something that's part of NIOSH, and because of the cuts, when I go to the website, as I am right now, it says the information on this page is not currently being updated and access to tool is limited. Firefighters can no longer enroll in the National Firefighter Registry for cancer. So I just raise this because this is incredibly important, not just for those that were at ground zero, but just writ large across our nation to try to help our firefighters. So can you promise me that we will work together and try to
I
get this
will-
back up and running as soon as
I
possible?
will work with you on this issue, Senator.
Yeah, look, I understand what you were saying when it comes to your prioritization, but I will tell you, it is sending an absolutely disastrous message, especially to our firefighters. I mean, I hope that on the list of things in this Congress that we think are bipartisan, are unanimous, it should be about supporting our heroes at the World Trade Center, especially when we have more firefighters who have died since 9/11 because of medical issues that they had working there at Ground Zero than those number of firefighters that died on September 11th. And so if we can't even agree on that, if that is not seen as a high enough priority to try to protect, then I am worried about everything else that is more controversial, has less unanimity. So Secretary, I will follow up with you on the National Registry, and I do want a firm answer on you on what is the final staffing at the World Trade Center Health Program. And with that, I'll yield back.
Thank you, Senator.
Kim opened his questioning by recounting a recent town hall back home in New Jersey. A fire captain who worked at Ground Zero stood up and spoke. The firefighter had been diagnosed with cancer. He told Senator Kim he was on borrowed time, and he was furious. That firefighter believed the administration had gutted the World Trade Center Health Program, a lifeline for thousands of first responders who rushed into danger on September 11th and are still paying the price decades later. Kim said he promised that fire captain he would bring that anger and those questions directly to the Secretary of Health and Human Services. Kim asked a simple but devastating question. What happened? Why was staff cut from a program designed to care for 9/11 responders? And what should these firefighters expect going forward? Subscribe now if you want continued coverage that connects policy decisions to real people and real consequences. Secretary Robert F. Kennedy Jr. responded by saying the staff had been restored. He acknowledged the cuts should not have happened and said he reversed them. When pressed on why the cuts were made in the first place, Kennedy explained they were part of sweeping budget reductions imposed across the department. Kennedy described HHS as the largest agency in government, even larger than the Pentagon, overseeing roughly 20% of the U.S. economy. He said his department was instructed to make painful cuts quickly and admitted mistakes were made along the way. But Kim was not satisfied with that explanation. He pointed out that these were not abstract line items. Cutting staff at NIOSH directly impacted the World Trade Center Health Program. He questioned whether Kennedy was aware that those staffing decisions would harm 9/11 responders or whether the cuts were rushed without understanding the consequences. Subscribe if you want accountability journalism that goes beyond official talking points. Kennedy defended his approach, saying the agency had grown too large for too long and that rapid action was necessary to prevent further expansion. He argued that waiting too long allows bureaucratic inertia to take hold, making reform impossible. He acknowledged that some decisions would need to be reversed once mistakes became clear. Kim then pressed for clarity. Would the World Trade Center Health Program return to full staffing levels as they were before Kennedy took office? Kennedy said the program would continue and that there would be continuity, but he stopped short of explicitly confirming full restoration to previous staffing levels. That distinction mattered. Subscribe now if you want coverage that listens closely to what officials say and what they do not say. Kim then raised another issue that alarmed him and the firefighter he spoke with, the National Firefighter Cancer Registry. This registry allows firefighters across the country to enroll and helps researchers track cancer rates linked to occupational exposure. Kim asked Kennedy to commit to working together to restore the registry as quickly as possible. Kennedy agreed to work with him on the issue. Subscribe if you want to stay informed about how decisions made in Washington affect first responders and public safety workers across the country. As Kim wrapped up his questioning, his tone became even more urgent. He warned that these cuts send a disastrous message to firefighters. He said support for 9/11 responders should be one of the most bipartisan and unanimous issues in Congress. Kim reminded the committee of a sobering reality. More firefighters have died since 9/11 from illnesses related to their service at Ground Zero than died on the day of the attacks themselves. If the government cannot protect and prioritize those heroes, Kim said, then it raises serious concerns about how it will handle more controversial and divisive issues. He ended by making it clear he would follow up. He wants firm answers on final staffing levels at the World Trade Center Health Program and concrete action to restore the Firefighter Cancer Registry. The exchange underscored a larger question that continues to hang over the hearing room. When budgets are cut, who bears the cost? And what does it say when the people paying that cost are the very ones who ran toward danger when the nation needed them most? If you want continued coverage that breaks down these moments and explains why they matter, make sure you subscribe.